Hello, I am back again, Dr. Ibe Nathans. And someone contacted me saying that she heard that taking ibuprofen in this period of COVID 19 can make you contract COVID 19 or indeed can make your symptoms worse. However, let me say that there are no evidences or the evidences are insufficient to suggest that ibuprofen can make you contract COVID 19 or indeed make the symptoms worse. Ibuprofen is a class of medications we call NSAIDs. NSAIDs means non steroidal anti inflammatory drugs. These are groups of medications under this class called the NSAIDs, non-steroidal anti-inflammatory drugs. Other drugs that are part of this NSAIDs are things like Feldane, naproxen, diclofenac, and so forth and so on. So coming back to this COVID-19, if you have mild symptoms, mild flu-like symptoms suggestive of mild COVID, such as headaches, slight temperature, body pain, yes, you can take paracetamol or ibuprofen. I would advise, however, please make sure that you read the leaflets, read the literature of the medications when you buy them over the counter, or when you buy them from your pharmacist or your chemist. Let me say furthermore that ibuprofen must be taken with food or after food. You don't take them without food. If you do, it can give you stomach upset, stomach pain, and if taken for a longer period of time, it can actually make you bleed inside. So they must be taken with food or after food. If you have a history of ulcer, stomach ulcer, if you have a history of acid reflux, or if you are somebody who always experience pain or discomfort after food, I won't advise you to take ibuprofen. Okay, so this is actually contraindicated. It must be taken with food or after food. Ibuprofen must be taken with food or after food. And furthermore, I don't advise patients over 65s. If you're 65 and above, I don't advise you take ibuprofen. You stick to paracetamols because there are evidences to suggest that over 65s taking ibuprofen can have stomach pain and can indeed bleed. And secondly, if you are taking medications for blood pressure, diabetes, or other medications that can interact with ibuprofen, I would strongly advise that you talk to your healthcare provider, your doctor, before taking those medications. Don't self-medicate, please. If you're over 65, if you are taking medications for blood pressure, diabetes, some cancers, and indeed some other forms of medications, make sure you seek advice from your healthcare provider. Yes, so to recap on what we were talking about, there is no evidence to suggest, or the evidence is insufficient to support or suggest that ibuprofen can make you contract COVID-19 or can make your symptoms worse. Ibuprofen must be taken with food or after food, never on an empty stomach. And if you have underlying diseases, taking medications for instance, high blood pressure, diabetes, or other forms of diseases, make sure you contact your healthcare provider. If you're over 65, I wouldn't advise you to take ibuprofen for headaches, mild temperature, body ache. Please stick to paracetamols because that can give you stomach pain, can make you bleed inside. Okay, I just felt I discussed this with us as it may benefit some of us. So yes, please take care of yourselves, take care of your loved ones, be safe and play safe. God bless. Bye.